an organization called Do No Harm released what they call the Stop the Harm database. Now, what this does, it catalogs the hospitals and the medical centers throughout the United States that have trafficked in gender procedures for children. The whole study takes place between the years between 2019 and 2023. And, we've got a lot, primarily within the LGBTQ community, that claim that all these interventions and so forth are not even happening. But the report found these experimental procedures are indeed happening. In fact, it has become an almost $120 million industry. It has affected nearly 14,000 minors, including more than 5,000 who have had mutilating surgeries. Wow. Well, joining me now to discuss this is Dr. Miriam Grossman. She's a board-certified psychiatrist. She's a senior fellow at the DoNoHarmMedicine.org and the author of 5 books, including Lost in Trans Nation, a child psychiatrist's guide out of the madness. What a great title. Dr. Grossman, welcome to Washington Watch. We're thrilled to have you.
Well, thank you so much for having me.
Okay, so let's just jump out of the gate. Tell us about this report. What did you find, and what do you hope that is going to be accomplished through this?
Well, this release of data is really a nuclear bomb. And I'm so pleased that Do No Harm, an incredible group of medical professionals, anyone who's in your audience who's a medical professional should join up, DoNoHarmMedicine.org. They yesterday released an incredible set of data. We've never had this before, in which they examined insurance claims that have been made by doctors and hospitals and clinics regarding so-called gender-affirming care, in which minors are provided with medical interventions in order to make them appear as if they are the opposite sex. Now, as you said earlier, we are led to believe by politicians and by many groups that these interventions are very rare and hardly happening at all in this country. And that is simply not true. And the numbers that you just mentioned, for example, 14,000 minors undergoing these treatments, that's actually an undercount, because Do No Harm was not able to, for example, access the records, the insurance claims from Kaiser Permanente in California, a huge, of course, health network of hospitals and clinics. And they do a tremendous amount of these gender interventions. They also are not counting any of the treatments that were paid for privately. So those numbers that you quoted, 14,000 undergoing treatment, almost 6,000 with surgeries, 8,500 receiving hormones and puberty blockers, and I don't think you mentioned this one, 62,000 prescriptions were written for minors, and the total submitted charges was over $119 million. So
wow.
This is an industry, and it is an industry that sterilizes minors, that leaves them unable to have biological children.
So let me ask you, with all of that was left out of the study, Kaiser Permanente and some of the others you mentioned, is it possible that these numbers, staggering as they are, could it be that these numbers really could potentially just represent the tip of the iceberg of what could really be taking place?
Well, look, we can only speculate about what's going on at Kaiser. People in the audience may be aware that Kaiser has already been hit with a few lawsuits, medical malpractice suits in California by residents there who have been harmed by their gender-affirming care. So we can only speculate. And in terms of what's going on, people who pay privately, that's also speculation. I know that at one point when I was writing my book, I went on to the that website where people raise money. What is that called?
GoFundMe?
Yes, GoFundMe. Thank you. So at the time, this was a few years ago, there were girls on there raising money for their double mastectomies. 47,000 girls
Wow.
were trying to raise money to pay for their mastectomy. So
Unreal.
yes, I don't know if this is the numbers are they're not 100% accurate. The numbers are actually higher.
It sounds like it certainly they're conservative numbers at best. So let me just ask, if I can, a little bit of a switching of gears. The study also came out with the dirty dozen. We're referring to the worst offenders as it relates to the hospitals that are participating in these type of surgeries. How did you compile this list of hospitals, this dirty dozen, and what did you find here?
Well, again, they looked at the hospitals that and the facilities that were offering these treatments, and they looked at the number of patients who underwent these treatments, the claims that were made to insurance, and the hospital's promotion of sex change treatments in the local community. Some of these hospitals are actually, activists. They are reaching out into the community and promoting their services. So those were all the different factors. And then they picked the 12 hospitals that were deemed to best meet those criteria. They called those hospitals the dirty dozen. So the one of the beautiful elements about this database is that people can go on there and see if their local children's hospital is one of those 12 dirty dozen.
Wow. All right. So one more time real quickly before I hit the next question. What is that website while it's on people's minds?
Yeah. Stop the Harm Database.
StopTheHarmDatabase.com. All right. Now, you've been a part of this battle and an advocate, a great voice for a long, long time. In fact, you recently testified before Congress. Why is it, this question comes to me a lot, why is it that the medical establishment is so willing to embrace these harmful procedures for children?
Well, there's two reasons. One is that our mainstream medical organizations, such as the American Academy of Pediatrics and the American Psychiatric Association, for many years have been taken over by a small group of activists who simply push their agendas forward and stifle debate. And second reason is that too many of my colleagues are simply spineless and not willing to speak up against it. But now, with the release of this database, there's really no excuse, and especially pediatricians, endocrinologists, and surgeons, enough is enough. You need to step up to the plate and do what every good ethical doctor is supposed to do, and that's speak the truth and to do no harm. And these children and families are being harmed in the most horrific way, because not only are they being physically disfigured, they're losing the capacity to have biological children in the future. Many of them will have impaired sexual functioning, inability to have sexual pleasure, and many, many other medical and psychiatric problems. So we are calling out, do no harm, where I'm a senior fellow, are calling out to physicians and other medical professionals to stand up, to join us, and to say enough is enough. We are doctors, we are medical professionals, and we're not going with radical, destructive agenda.
Good for you. Yeah, and it's time to stop the harm for sure. I would say probably a third reason you brought it up a moment ago is the money. I mean, this is now a huge industry that's fueling all of this. But in talking about putting a stop to it all, we are seeing some momentum backing away from this ideology. I mean, the Cass report, I'm sure you're familiar with, it spurred a ton of changes in the UK. In fact, even here in the United States, when it comes to some of these medical associations, most of them certainly have fallen in line, but I think it was last month the American Society of Plastic Surgeons broke away with all this transgender ideology. They came out and stated that their organization opposes all the unscientific consensus that's prevalent throughout other professional medical organizations. So are we watching a movement away from all the stuff?
If I could just correct you for one moment, that was the president of the American Association of Plastic Surgery, the president, not the entire organization. But yes, I'm very optimistic, in fact. And having watched this develop, over many, many years, I'm extremely optimistic to see all the changes just in the past year. As you say, the Cass report, the many countries in Europe and elsewhere that are turning around and saying there's no evidence that we're even helping these kids, and what the kids need is psychotherapy. So yeah, there's a tremendous things are turning around, and I am optimistic that we are winning, but yet the body count is very high.
Well, it needs to turn around. I mean, the science is not there. The harm being done to children, it's all just glaring us all in the face that this kind of stuff needs to stop. So along those lines, let me ask you this. When people are told that they are born or may be born in the wrong body, from your position as a psychiatrist, what does this do to the person?
Well, this is an extremely decent children, especially, and that is what's going on from a very, very young age. Kids are being told that when they were born, the adult in the room just made a guess about whether they were a boy or a girl, and that guess may have been correct or it may have been incorrect. This is a terribly destabilizing and false idea to plant in these young minds. So, we really need to go back to the very beginning of all this education forced on children through sex education, Planned Parenthood, SECUS, and abort. Because to answer your question, it makes them terribly confused, anxious, and sometimes suicidal.
Well, there's no doubt it would do that. I mean, you could just see it coming. And if they cannot deal with truth, that there's male and female, that they are one or the other, if they can't embrace that basic reality and truthfulness, then any other, it seems to me, truth in the world becomes suspect. I mean, what in the world do they land on upon what is right and wrong, what is truthful, what is false, if they cannot even comprehend, and if they are told, in fact, that they are born in the wrong body? I mean, it has to have enormous psychiatric impact for years to come.
Well, kids look to adults and when adults fail to do that, when adults fail to represent, first of all, that there is reality. Reality is not a subjective, made-up kind of a thing. Everyone makes up their own reality. There is one reality. And the reality is that we are all born, we are all from the moment of conception, either male or female. And so you're 100% correct. This is a terrible thing to do to young children. And then everyone is scratching their heads and, complaining and saying, well, there's so many mental health issues among our youth. Well, yeah, there's so many mental health issues for many reasons. But one big reason is that we are misrepresenting reality to these children. And we are leading them to think that they can just, each person creates their own reality. So that is extremely destructive, from a mental health perspective.
Dr. Miriam Grossman, thank you so much for joining us today on Washington Watch. We appreciate you unpacking this great information for us. We appreciate it. Thank you.
Thanks for having me.